everybody, and welcome to Wellness Wednesday. Today I'd like to talk to you guys about something that I deal with every day, and that is fibromyalgia. Fibromyalgia is defined as a medical condition with the characteristics of widespread body pain and also heightened sensations to any kind of pressure. Widespread pain isn't the only symptom of fibromyalgia. It also comes along with fatigue or tiredness that can completely wipe out your whole day. This chart helps to show more of the symptoms of fibromyalgia. As you can see, it's more than just the muscle pain and fatigue. It also affects your central nervous system with chronic headaches, sleep disorders, and that ever-famous fibro fog. Let me tell you how much fun that is to deal with. It can also contribute to vision problems, different skin issues, extreme cramping on your period, and let's not forget the #1 best symptom, weight gain. Yay! Fibromyalgia is also associated with depression, anxiety, and post-traumatic stress disorder, or PTSD, although not everybody that has fibromyalgia also suffers from the psychiatric disorders. Stress can also be a very key factor in fibromyalgia. Unfortunately, the exact cause of fibromyalgia isn't known at this time, but they do believe that psychological, neurobiological, environmental, and genetic factors could be involved. As I mentioned before, a lot of the genes that are also present in major depressive disorder are also seen in fibromyalgia. The widespread body pain, which is the most well-known symptom of fibromyalgia, is caused by neurochemical imbalances in the brain. These imbalances cause your brain to make your body process pain in an abnormal way. If you were to look at a scan of a brain of someone with fibromyalgia and someone without, you could actually see some functional and structural differences, though doctors aren't 100% sure if this is because of fibromyalgia or because of an underlying cause. While a lot of people think that fibromyalgia is just a made-up condition, I can assure you that it is not. It's recognized as a disorder by the U.S. National Institute of Health and the American College of Rheumatology. Fibromyalgia is estimated to affect about 2 to 8% of the population and is more common in women than men. There are certain criteria that doctors will look at before they make a diagnosis of fibromyalgia. One thing is they'll ask, have you had your widespread pain for at least 3 months? And have you felt it in all 4 quadrants of your body, meaning your left side, your right side, above the waist, and below the waist? There are also 18 tender points shown here that doctors will check when making their diagnosis. There used to be a set number of these tender points that you had to feel pain in to have that diagnosis of fibromyalgia, but now people aren't so sure that that's the only kind of tool that they should use, so it's kind of more of a guide than an exact diagnostic tool. There are different medications that can be used in the treatment of fibromyalgia, from antidepressants like Cymbalta to anti-seizure medications like Neurontin, and also some opioids for pain. I take one of the anti-seizure medicines called Neurontin, and while it really helps me, it's kind of seen to only help about 30% of the patients that take it. Also with the opioids, they try not to use anything too strong. I was on tramadol and that helped. It didn't completely take away the pain, but it would kind of take the edge off of that pain. Of course, one form of treatment, which is a treatment option for loads of different disorders, is exercise. And so long as you are feeling up to doing it, going for walks, anything cardiovascular, especially aquatherapy, because you have the mixture of cardiovascular and resistance training, it can really do wonders for fibromyalgia. Fibromyalgia is not a fatal condition. However, it is very pervasive and chronic. Most people that have fibromyalgia report that they don't see many changes as far as their symptoms improving over time. From a personal perspective, I can tell you this is not a fun condition to be dealing with day to day. I have such severe pain that, I wouldn't even wish it on my worst enemy. I have some days where I feel really great, and I'm not really feeling a lot of pain and I can get a lot done. Then I have those days where getting out of bed in the morning is an accomplishment in itself. I've joined a few different forums online, also some groups on Facebook, and I've learned a few great tips for when I'm having a bad day. By far, one of the best tips that I learned on one of the forums was on those days when I'm just totally achy from head to toe, I just spend a few minutes under my heated blanket. This, ladies and gentlemen, is Barnabas. His name means comfort, and that is exactly what he gives me. About 10 to 15 minutes under this guy, and I'm feeling so much better. One of the biggest lessons that I had to learn through all of this is that I can't push myself too hard on those days that I'm feeling really good, because then that means that I'm going to be down and out for a couple of days. It's really hard on those days when your body just wants you to slow down and stop and take a rest, but you want to do so much. You kind of have to learn to listen to your body and give it that little break that it needs. I think one of the hardest things that I have experienced is when people think that you're making this all up and that, you're just being lazy. You don't want to do anything, oh, you're tired. Maybe you should sleep some more. If you could experience for a moment the extreme pain, the the fatigue, the brain, I mean, I hope that you never do feel it. I really, like I said, I don't wish this on anybody. If you were to experience it though, you would know how real this condition is. I'll leave some links down below so you can get some more information on fibromyalgia if you'd like to. Also, Fibromyalgia Awareness Day is the 12th of May, so if you'd like, wear some purple to show your support for fibromyalgia awareness. As always, guys, if you have any questions or comments, please leave them down below for me. If you like this video, give me a thumbs up, subscribe if you haven't already, and it has been a pleasure sharing this information with you. I love you guys. See you next time. Bye.